Welcome to Mindful Objective, the podcast where we explore the root causes of health concerns and help you restore balance. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. And today we're diving into Omega-3, which is one of the most underrated nutritional tools in the modern world. Most people think omega-3s are just good for your heart, but their impact goes far beyond that. Your brain, your joints, mood, hormones, and immune function all rely on these essential fats to operate at their best. In this episode, we're going to explore what omega-3s really are and why so many people are deficient, how they may support brain health, cardiovascular wellness, and inflammation balance, the difference between fish oil, flax, and algae-based sources, what at-home lab testing can reveal about your omega-3 status, and why that matters. As always, this podcast for educational purposes only. We do not diagnose, treat, or cure any illness or disease. So let's go ahead and get into it. So let's start with the basics because most people think they know what omega-3s are, but very few understand why they're so critical and how often they're actually missing. Omega-3 fatty acids are essential nutrients, meaning your body doesn't make them on its own. You have to get them from food or supplements. And the reason they matter so much is that they play structural and functional roles in nearly every cell in your body. The three main types of omega-3s are ALA. This is found in flaxseed, chia seeds, hemp, and walnuts. It's a plant-based and considered a short-chain omega-3. Then we have EPA. This is found in fatty fish like sardines, mackerel, anchovies, and salmon. It's known for supporting inflammation balance. DHA. This is also found in fatty fish and algae. DHA is a major structural fat in the brain, eyes, and nervous system. So ALA is the most common type in the modern diet, but here's the issue. Your body has to convert ALA into EPA and DHA to make use of it. And that conversion is incredibly inefficient. Some studies suggest the rate is less than 5%, and in many people it's barely 1 to 2%. That means you could be eating flax and walnuts every day and still not get enough EPA or DHA to meet your body's needs. This is a real concern in our practice, right? We see it a lot. When we see clients dealing with chronic fatigue, dry skin, joint discomfort, irritability, or mood fluctuations. So we always start asking the questions. How much fish are you eating each week? As many of you know, I am not a fish eater. I do not like fish. I do not like the texture or taste. So supplements, it is for me. So we always ask, are you supplementing with a quality omega-3 source? Are you consuming processed seed oils that may throw your omega-6 to omega-3 ratio out of balance? And a lot of people are. That brings up another point, balance. Right? The modern Western diet is overloaded with omega-6 fatty acids, primarily from soybean oil, corn oil, canola oil, and processed snack foods. While omega-6 fats aren't inherently bad, the problem is the quantity. Our ancestors likely consumed omega-6 and omega-3 at a ratio close to 1-to-1 or 2-to-1. Today, most Americans are somewhat between 15-to-1 or 25-to-1. And that's high omega-6 environment promotes a lot of inflammation. So inflammation is always bad, right? It's part of your body's healing response. But chronic low-grade inflammation is a key driver to nearly every modern health challenge, such as heart disease, arthritis, autoimmunity, cognitive decline, and even insulin resistance. That's where omega-3 shine. They help support your body's natural inflammatory resolution process. EPA in particular is a precursor to signaling molecules that calm your immune system and help prevent chronic overreaction. But you can't know where you are unless you test. And that's why we use the omega-3 index test in our integrative health practice. It's simple at-home blood test that looks at the percentage of EPA and DHA in your red blood cells. It gives you much more accurate picture than just tracking food intake because it reflects what's actually being absorbed and utilized by your body. And again, people process things differently based on their body. So that's why always good to test. Here's what we typically see. 3 to 5%, that's where most people fall, and it's considered suboptimal. 6 to 7%, you're getting closer, but there's still room for improvement. 8% or higher, that's the optimal range associated with healthy aging, better brain function, and lower inflammation markers. Testing is empowering. It removes the guesswork, as we always say. And when we show people their numbers, it often clicks. This might be part of why I'm feeling this way. So in general, yeah, omega-3s are highly essential. right? There are plant-based sources out there for those that do not want to eat fish. So we also need to understand that high omega-6 to omega-3 ratio. These are all critical things we need to do. And testing's simple. So there's no real excuse why not to do this. And a lot of people just do not know there's options for testing because regular medical clinics do not test your omega-3 to omega-6 ratios. Let's turn our attention to something we rely on, but most of us take for granted. What is that? Our brain. When people feel mentally off, you might feel foggy, unfocused, tired, emotionally flat. They often assume it's stress, burnout, or lack of sleep. We see this across the board. And yes, those all play a role, but what many don't realize is the fatty acid balance, especially omega-3 status, is often at the root of the poor brain performance. Your brain is composed of nearly 60% fat. Of that, a substantial portion is made of DHA. It's a long chain omega-3 that gives your brain cells their structure and flexibility. DHA is like scaffolding of your nervous system. It helps your brain cells communicate with one another. It regulates your mood and responds to stimuli appropriately. But when you're low in DHA and EPA, here's often what we see: brain fog and forgetfulness, sluggish thinking, poor focus and attention, increased irritability or anxiety. Another one could be low motivation or mood dips. These aren't just random symptoms, right? They're signals that your brain may not be getting the building blocks it needs. How many of us address our brain health? Not many. In integrative health, we look at symptoms like this holistically. And one of the first things we assess when our clients report mental fatigue or mood issues is dietary fat intake. Not just how much fat, but what kind? What are you intaking? Here's something most people don't know. High levels of processed vegetable oils, these are rich in omega-6, may disrupt your brain cell membranes. These oils compete with omega-3s and may even interfere with your neurotransmitter function. That means your thoughts, memory, and mood can suffer, not because your brain is broken, but because your brain is inflamed. This is where EPA plays a critical role. EPA helps modulate the body's inflammatory process, which turns supports your neuroinflammation resolution. This is a fancy way of saying it helps calm down overactive immune signaling in the brain. And this matters because chronic neuroinflammation has been linked to mood issues, cognitive decline, and also poor memory retention. Clients who started targeted omega-3 support often report a sharper thinking within weeks, more emotional stability during stressful events, a greater sense of calm or reduced mental chatter, even improvements in PMS-related mood changes. Now, you might be wondering, how do I know if my brain's low in omega-3s? That's where omega-3 index test comes in. We actually see those numbers. You're not guessing. This is a simple at-home test. It's a great tool in evaluating cognitive support potential. We had clients who didn't think much of their symptoms until they saw their EPA DHA levels at 3%, well below the optimal zone. Once they began adjusting their intake, they felt total different and improvement, right? In their focus, energy, and even their mood, right? Their moods were more stable. It's important to note that the test doesn't diagnose anxiety, depression, or cognitive disorders. It's important to note that the test doesn't diagnose anxiety, depression, or cognitive disorders. What it does is provide a nutritional snapshot. It shows whether you're giving your brain the fats it needs to function at its best. Everything's about that optimal zone. And if you're a plant-based diet or you're a vegan, this is especially important. DHA and EPA are typically only found in animal sources like fish, and ALA from plant foods, it doesn't always convert to usable forms the brain needs. In these cases, algae-derived omega-3s can be an excellent alternative. Our general approach here in our practice, if you're eating fatty fish 2 to 3 times per week, you may be getting enough. Again, not me. I do not like fish. So omega-3 supplements is what I do. If you're not eating that fish 2 to 3 times a week, you may be experiencing brain-related symptoms, and we suggest testing. And if your levels are low, we use high-quality third-party tested omega-3 supplements, ideally in triglyceride form, and the reason for that is better absorption. And we always remind our clients, nutrition is not a magic switch, right? The brain takes time to repair, and changes can be subtle at first. But over time, continuing doing, taking care of yourself, it has an effect on your brain, and that effect is huge. So now let's talk about what omega-3s were first known for heart health. Now let's talk about what omega-3s were first known for. Heart health. All right, this is where, the general media talked about them. Yeah, eat them. It's good for your heart. So, for decades, cardiovascular disease has remained the leading cause of death worldwide. And while conventional medicine has made incredible strides in emergency care, like life saving interventions for heart attacks, it often falls short of when it comes to prevention. That's where omega 3s come in. These fats may not grab headlines the way cholesterol lowering drugs do, but their role in supporting cardiovascular health is well documented and often underappreciated. Let's talk about how omega 3 support your heart. That's been a long case study. We know they definitely help your heart. So, omega 3s, particularly EPA and DHA, are associated with lowering triglyceride levels, improved heart rate variability. They support your healthy blood pressure, reduce arterial stiffness, healthier blood flow and circulation. Each of these markers contribute to what we call vascular resistance, your blood vessel's ability to respond to physical and emotional stress without becoming damaged or inflamed. One of the most important effects of omega-3s is how they support inflammation balance in your body. Unlike omega-6 fats, which tend to push your body toward inflammation, omega-3s help regulate the response and encourage resolution. This is a key term in integrative and functional medicine. Inflammation, in the right context, again, is essential. Helps your body respond to injury or infection. But chronic low-grade inflammation, the kind that builds up quietly from poor diets, stress, toxins, and lack of movement, have been linked to everything from high blood pressure to insulin resistance. This is one reason we often see clients no cardiovascular symptoms, maybe just they have fatigue or poor recovery from workouts, who show early signs of inflammation on advanced labs. These individuals may benefit from nutritional interventions like omega-3 support, even before their traditional labs reflect the problem. The omega-6 to omega-3 ratio is one of the most telling markers of inflammatory load. A balance ratio typically is around 4 to 1 or lower, but many Americans are closer to 15 to 1 or even 25 to 1, driven largely from excessive consumption of processed oils and packaged food. When the ratio is off, your body becomes prone to producing more inflammatory cytokines, which are signaling molecules that cause damage to blood vessels over time. This is why we emphasize on dietary correction and supplementation when needed. Increasing wild-caught fish like salmon and sardines help. For many clients, it's simply not realistic to eat fish multiple times per week. Or, like me, just don't enjoy it. That's when high-quality omega-3 supplements become a practical tool to help you restore balance to your body. You know, you can't manage without measuring. That's why we do these at-home tests. That's why we use at-home omega-3 index testing to assess cardiovascular risk from a nutritional lens. These tests are easy, just a small finger prick, sample mailed to the lab. Results typically show your omega-3 index go 8% or higher, your omega-6 to omega-3 ratio, specific breakdowns of EPA, DHA, and ALA. Clients are often shocked by how low their numbers are, especially when they thought their diet was pretty healthy. You hear that a lot. I thought I eat good, but until you test, you don't know. Seeing a 3.5 omega-3 index create a powerful moment of awareness and a clear next step, right? At that point, you see the numbers, you said, okay, now I know what to do. It's important to clarify that we do not use tests to diagnose heart disease or any condition. It's a wellness tool that provides insight to your nutritional foundation and inflammatory environment. And if you're working with a healthcare provider, these results can be a valuable part of a broader cardiovascular support strategy. We run these labs and you can always provide them to your physician and they could take different actionable steps on their side. We often separate the brain and heart health in a conversation, but psychologically, these are deeply connected. Inflammation that affects the blood vessels also affect the brain. That's why omega-3s are considered foundational in supporting cognitive aging and vascular integrity. In some studies, individuals with higher omega-3 levels had less brain atrophy, improved blood flow to the brain, and fewer signs of neurodegeneration. In short, what supports your heart also supports your mind. So if you've been feeling off, tired, inflamed, stiff, or just not recovering well, this is a signal to consider what's happening inside your blood vessels. Because inflammation doesn't always scream, sometimes it whispers until it doesn't. Now that you understand why omega-3s matter, especially for your brain, heart, and inflammation balance, here's the reality. Just knowing isn't enough, right? You need to choose the right kind, take the right amount, and avoid the common traps that make people think they're covered when they're not. But are they doing any good or are they causing more damage? Let's break it down. Source matters, right? The most reliable sources of usable omega-3 and EPA and DHA are found in wild-caught fatty fish. Those are those sardines, salmon, mackerel, anchovies. Fish oil supplements, algae-based omega-3s. Those are for plant-based users. right? If you like to keep it plant-based or you don't want to eat, different kind of fish, you have the option for algae-based also. Many people assume that eating walnuts, flax seeds, and chia provide all the omega-3 they need. This is incorrect. Those foods do contain ALA, but your body must convert that ALA again to EPA and DHEA, and that process is extremely inefficient. In most people, less than 5% of ALA converts to EPA, and even less for DHA. That means unless you're intentionally eating cold water fish or supplementing with fish or algae oil, you're most likely not meeting your body's omega-3 needs. If you're plant-based, algae-derived supplements are a powerful option because they contain preformed DHA and EPA. These are the exact form your body uses without needing to go through the whole conversion steps. We need to know what's actually being absorbed. So not all omega-3 supplements are created equal. One of the most important distinctions is the form of the oil. You have the triglyceride form. This is closest to how fat exists in nature. This is better absorbed. You have the ethyl ester form. This is chemically modified and often less bioavailable. And you have your phospholipid form, like krill oil. This has good absorption, but often lower in EPA and DHA content. So many big box brands use the ethyl ester form because it's cheaper. But if you're taking a supplement and you're not absorbing it, you're wasting your time and money. That's not helping your health. We recommend the reesterified triglyceride form, omega-3, and the reason for this is it's better tolerated, better absorbed, and it's usually more stable and less prone to oxidation. We always want to look for third-party certifications to ensure purity and potency. These organizations test for heavy metals, dioxins, PCBs, and rancidity. And you have to know too, there is a lot of fish out there that contain a lot of omega-3 out there and fish that contain a lot of heavy metals. Another important aspect of dosing. This is where most people get it wrong. They see a label that says 1,000 milligrams of fish oil and they assume they're covered. The total fish amount is not the same as EPA and DHA content. You need to look at the actual breakdown on the label. Again, labels are important. Here's what we recommend based on goals. General wellness, 1,000 to 1,500 milligram combined EPA and DHA daily. Inflammation and brain support, you want 2 to 3 grams combined daily. Low omega-3 index may require higher intake, up to 4 grams short term. If you're having, higher dosages, always split those dosages into 2 different doses with food. Omega-3s are fat soluble. They absorb best when you eat meals that include fat. And if you're on blood thinners, work with your healthcare provider before increasing your dose. Omega-3s can naturally thin the blood slightly, which may affect medication interactions. Let's now discuss common mistakes we do see at our practice. Let's cover a few of the biggest pitfalls. Using generic fish oil without checking EPA, DHA content. Some brands contain just 300 milligrams of EPA or DHA total, despite labeling the capsule as 1,000 milligrams. And that's just not enough, just wasting your money. Taking it without food, you absorb far less, especially without fat in the meal. Using oxidized or rancid products. If your fish oil smells fishy or gives you burps, it may be oxidized. That's not just unpleasant, but it promotes oxidative stress, just harming the body. Or they fail to recheck their levels. You might need more or less, depending on how your body responds. A follow-up omega-3 index test, we usually do this 8 to 12 weeks later, is the best way to personalize your dose. So, you do your initial test, you understand your ratio, you understand where you may be lacking or you may need to, tweak it a little bit. And then you go from there, take the supplements 8 to 12 weeks, say at that 12-week mark, you decide, let's retest and see, do I still need 2 grams? Maybe I need to up it. Maybe I need to lower it. We don't know until we test. In our integrative health practice, we guide clients through a simple yet powerful approach. Always assess your symptoms and dietary intake, right? First thing we do. Then we run an at-home omega-3 index test. Then once we get that, we want to begin a personalized omega-3 supplementation. Oftentimes, we'll combine this with magnesium, vitamin D, K2, or a CoQ10 if needed. Then again, retest in 2 to 3 months, and then we'll adjust accordingly. So this approach helps remove guesswork and ensures you're getting what your body actually needs, not just what the label says. Because again, not everybody, depending on the supplement, not everybody absorbs it the same. And maybe you're somebody that doesn't take it with food and you may need to up your dose. You will not know until we retest. As we wrap up today's episode of Mindful Objective, I hope you're walking away with a deeper understanding of just how critical omega-3s are, not just for your heart, but for your brain, mood, inflammation balance, and overall vitality, right? We want to live long and healthy. We want to be pain-free if we could get there. So you got to think of your long-term health. In the world of integrative health, you're not just chasing symptoms. We're asking better questions. And sometimes the answer is as simple as restoring what your body is missing all along. As a reminder, this podcast for informational purpose only. It does not constitute any medical advice. Always consult your healthcare provider before making health decisions or changes in your routine. So if you've been dealing with fatigue, brain fog, joint discomfort, or just feeling off, don't guess. Let us test. It's not expensive at all. It's a pretty quick test too. Our at-home Omega-3 index test makes it easy to understand your levels and take informed steps forward. All of our professional-grade supplements are available at 20% off retail exclusively through our platform. Higher quality and often more affordable than major online retailers. Never hesitate to reach out if you have any questions. If you ever want to ask a question, have your question on the podcast, visit mindfulobjective.com/podcast. Again, that's mindfulobjective.com/podcast. Thanks for tuning in. If this episode resonated with you, please share it with someone who might benefit and leave us a review. Till next time, stay curious, stay empowered, stay mindful, and stay well.